Tonight we are in the Boyd's community at the Brantywells Primary School, where we took the education to the community. We allowed the persons within the community to be able to ask questions about the AstraZeneca Oxford COVID-19 vaccine. We were privileged enough to have Dr. Wilkerson here with us tonight, sharing the information and answering the questions. We had quite a number of questions from the persons who were here, and fortunately for us, we were able to get quite a number of persons who were able to sign up as well and are willing now to take the vaccine because they were able to have this session. This is the first in a number of community level sessions that we are going to have with persons, because we know it's important for persons to be able to ask the questions and be able to debunk some of the myths and the untruths that are out there about the COVID-19 vaccines. And so we are happy that we were able to be here at the Brantywells Primary School in Boyd's. Next Wednesday we're going to be in two communities actually. We're going to be in the St. Johnson Community Center, but we're also going to have another team that's going to be at the McKnight Community Center doing the same thing, sharing the information and giving persons as much feedback as we can about the AstraZeneca COVID-19, because it's important for us to make sure that we reach that 70% herd immunity necessary for us to be able to get our lives back to as normal as possible. And so we're encouraging everyone to roll up, to roll out. Don't wait, vaccinate.
It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, one people. We are roll up to roll out, cause no man's alone. Do what's right, alright, cause I love you, brother, my sister, and we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to roll up, to roll out.
Bless up. Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Is on.
Good afternoon and a warm welcome to all of you who have joined us today, whether you have joined us via television, via radio, or via social media. Thank you very much for joining us today. This is the National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 14th day of April 2021. We continue to bring you updates in terms of what is happening with the COVID-19 pandemic. Of course, as you know, the pandemic is still with us, and we are at a critical stage where there has been, in many countries, the vaccination roll out. And all that is now being said is that the vaccine is our best hope of returning to some form of normalcy in all countries around the world that have been affected by the corona pandemic. It has caused untold suffering, it has caused death, it has caused a lot of grief, it has brought about economic hardship, it has brought about many social constraints and restraints all around the world, something we have not seen in a century. Now that the vaccines are here, of course, we have a responsibility, moral and ethical responsibility, to be vaccinated, as it is a means of not only protecting ourselves, but protecting our families, our brothers, our sisters, our neighbors, our community. And that is what we mean when we say herd immunity. We are not talking about cattle, we are talking about human beings. It is people immunity, community immunity, family immunity, societal immunity, carnival immunity, music festival immunity, Culturama immunity, White Sands immunity, Latin festival immunity. What that basically means is that when people are vaccinated, I'm not a doctor, but I have a little common sense. When people are not vaccinated, when people are vaccinated, what happens is that they reduce infection rates and transmission rates. And basically, that is what basically happens. You reduce your risk of contracting the COVID-19 virus and also the risk of transmitting it to other people and so on. No one ever said that the vaccines are 100%. They're 80-something percent, 90-something percent, which means we should not be alarmed if a person is vaccinated and still contract the virus. But what it means, the good thing it means, is that you will not get severe COVID. The chances of you dying are almost negligible. And of course, you won't be hospitalized because your immune system is ready to fight this dreadful virus. So we encourage persons to get vaccinated. Of course, it's not a dictatorship. It's not about, using force and all of that, but it's to help people to understand. And that is why these NEOC briefings are so important as we continue to bring you relevant and pertinent information in terms of how you can best manage the pandemic in your own way. And we are all in this together. Today, I would first invite Dr. Cameron Wilkinson, who is our Medical Chief of Staff at the Joseph N. France General Hospital. Dr. Wilkinson is going to come and he's going to give a tribute to the late nurse from the Philippines who died, Josephine Arceo. Dr. Wilkinson.
Thank you, Leslie. Nursing is a profession that only a selected few can pursue. It demands a lot from those who enter the field. To be a good nurse, one has to possess certain qualities, including a caring and empathetic attitude, good judgment, and communication skills. One must also be detail-oriented, emotionally stable, functioning in very stressful environments, and have the physical endurance to work long hours, even on weekends, holidays, and special personal days like birthdays. Nurse Josephine Arceo possessed all these qualities and more that made her excel at what she loved best, that is caring for the sick and vulnerable. She came to St. Kitts 5 years ago and dedicated her life to serving the people of this federation right up to the time of her death. She was so committed to the health care of this nation that she was active in recruiting her daughter, who is also a nurse and has served on the oncology unit for the last 4 years. Nurse Aser was an outstanding midwife and helped bring many of our Federation's children into this world, some who I am sure will go on to be leaders of our country in many different disciplines. She also trained many nursing students in the art of midwifery. She has therefore contributed significantly to the present and future development of a country that was not even her own. For her contribution to our nation, we are eternally grateful. The entire medical fraternity mourns her loss. It was especially tough for some of her nursing colleagues moving on with their regular duties at the hospital yesterday, and the necessary counseling was given to those who needed it. We will never, however, be able to imagine how this loss has affected her close friends and family. I pray that the Lord gives them the comfort that they need at this time and the strength to go on as they try to deal with this loss. My heart is especially filled with grief as I think about her daughter, Nurse Roseanne de la Cruz of the oncology unit. This is a very difficult time for her, and we want her to know that she is in our thoughts and prayers. We are indeed indebted to this nursing stalwart who contributed so much to our health institution, and to her daughter, and to all the nurses from the Philippines who make that long trip across the Atlantic, far from home and loved ones, to help us in specialty nursing fields like oncology, hemodialysis, accident and emergency, operating theater, respiratory care, and maternal and child health. Let us show Nurse Aser the dignity and respect she deserves in death, as she showed us while she was here in life. I urge those who have falsely associated her death with the vaccine to desist from spreading such false rumors. We can have disagreements and discussions on the vaccine and the vaccine rollout. It's ingenuous to make baseless claims that her death was related to the vaccine at this time of the family's grief. She was a staunch soldier in the fight against COVID-19 and was one of the first frontline workers who stepped forward and got vaccinated, not just to protect herself, but the newborns, the pregnant and the nursing mothers with whom she worked with on a daily basis, and also all those who access care at the Josephine France Hospital. She certainly would have been saddened to learn that her legacy in this fight was being falsely tarnished. We will never forget the warmth that she brought to work on a daily basis as she served the people of our Federation. May her soul rest in eternal peace as the family mourn her loss and prepare to have her body repatriated to the Philippines. The Ministry of Health and the government of the Federation of St. Kitts and Nevis extend sincerest condolences to the family of Nurse Aser and the entire Filipino community. Her selfless service to our nation will never be forgotten. I thank you.
Thank you very much, Dr. Wilkinson, for that tribute to Nurse Josephine Aser, who died serving. I now invite Superintendent Cromwell Henry, member of the National COVID-19 Task Force, to address us.
Good afternoon, and a pleasant good afternoon to all listening to this broadcast by whatever means. This afternoon, I will speak to us briefly on the function of the National COVID-19 Task Force as set out in the COVID-19 Prevention and Control Act. The National COVID-19 Task Force is responsible for the coordination of the national response to COVID-19. The task force may liaise and consult with such other public and private agencies and bodies as may be necessary. The powers and duties of the National COVID-19 Task Force are as follows. 1. To implement national initiatives as it pertains to the prevention, mitigation, and suppression of the spread of COVID-19. 2. To inspect or visit various facilities, including schools, hotels, guest houses, places of business, places of quarantine, places of isolation, and other relevant locations or facilities for the purposes of ensuring conformity with the provisions of this Act and any relevant laws pertaining to the prevention, mitigation, and control of the spread of COVID-19. 3. To liaise and consult with relevant public and private agencies as may be necessary. 4. To conduct programs of public information and education on the mitigation of, preparedness for, response to, and recovery from COVID-19. 5. To identify compliance teams to assist in its operations. And 6. To guide the public on the implementation of measures to combat the spread of COVID-19. The National COVID-19 Task Force is comprised of the following members. The National Disaster Coordinator, who shall be the chairperson. The Chief Medical Officer, who is the co-chairperson. The Medical Officer of Health for NEVIS. The Medical Chief of Staff. A Senior Representative of the NEVIS Disaster Management Authority. A Senior Representative of the Ministry of Health. A Senior Representative of the Ministry of National Security. A Senior Representative of the Royal St. Christopher and Nevis Police Force, a Senior Representative of the St. Kitts and Nevis Defense Force, a Senior Representative of the Immigration Department, a Senior Representative of the Customs and Excise Department, a Senior Representative of the Ministry of Foreign Affairs, and a Senior Representative of the Department of Information and Technology. Also includes Senior Representative of the St. Kitts Ear and Seaports Authority, and finally, a Senior Representative of the Nevis Ear and Seaports Authority. As the country prepares for its full opening in October, the task force is working closely with the Ministry of Health and other stakeholder groups to ensure that we can do so in a safe and sustainable way, to avoid any chance of the virus impacting the country in any adverse way. As we embark upon our quest to educate the country and encourage in the taking of the vaccination, the COVID-19 vaccine, we ask for the full cooperation of all, bearing in mind that we are doing all this in preparation for the opening of the country, the safe opening of the country in October. Thank you.
Thank you, Superintendent Henry. I now invite Chief Medical Officer Dr. Hazel Laws to give us the Health Emergency Operations Center situation report. Dr. Laws.
Thank you, Mr. Williams, and a warm good afternoon to everyone. So this afternoon, again, it's my task to share with you the HEOC situation report for today, Wednesday, April the 14th. The Federation of St. Kitts and Nevis would have confirmed 44 cases of COVID-19, and all 44 cases have recovered, and so we have 0 cases at present being monitored, and we hardly had any hospitalizations of any of these cases. Now, medical practitioners globally have been responding to this COVID-19 pandemic for about 15 months. So now over this time period, approximately 137 million persons have been confirmed with COVID-19 and 2.9 million persons have died. 31.4 million of these confirmed cases were reported by the United States of America alone, and over 563,000 of the deaths were reported by the US. In the Caribbean region, the numbers continue to climb gradually. Now within the CARICOM member states, the CMS CARICOM member states collectively have reported over 147,000 confirmed cases of COVID-19 and over 2,300 deaths. Within the Organization of Eastern Caribbean States, we've been monitoring the 9 territories, and at present, collectively, the OECS states have reported over 11,509 confirmed cases and approximately 150 deaths. Like St. Kitts and Nevis, the other OECS territories have also rolled out their COVID-19 vaccination program. As you can see, these are the approximate numbers of the first vaccine doses that have been administered. Now, in St. Kitts and Nevis, we have rolled out our program. We rolled out our program on Monday, February the 22nd, approximately 7 weeks ago. Now, on the screen, you would see the data as at last evening. However, today's data just came in, and we would have added a total of 194 doses to what's on the screen. So to date, we would have administered 11,152 doses, meaning the first dose to 11,152 persons. Let me break this down. 8,385 doses were administered St. Kitts, 2,767 doses in Nevis. And so to date, we would have provided coverage to 33.8%, or say 34% of our target population. So we would have administered the first of 2 doses of the COVID-19 vaccine to approximately 34% of the target population. Now, in terms of testing, within the Federation, we continue testing all suspected cases of COVID-19. So anyone who presents with COVID-19-like symptoms, they are tested. So our surveillance program continues. To date, we would have conducted well over 13,000 tests. Over 13,000 persons have been tested to date, and the positivity rate is one of the lowest in the regions in terms of just about 0.3%. So this slide just shows that we've had 44 recovered cases, no active cases being followed, and at present we only have approximately 267 persons in quarantine. And so, ladies and gentlemen, we continue to promote the AstraZeneca Oxford vaccine. It provides a coverage of it provides you about 83% risk reduction in terms of your being able to pick up the SARS-CoV-2 virus and become infected or experiencing symptoms. We are presently using a dosing schedule of 10 weeks. So you receive the first dose and you'll be given a 10-week appointment to return. We are administering this vaccine to adults, persons over 18 years of age, and it's proven to be quite effective against the emerging SARS-CoV-2 variants that have been identified in the United Kingdom, it also provides protection against the variant identified in South Africa and Brazil. Some of the most common post-vaccine symptoms, as highlighted by the approximately 11,000 persons who have received the first dose so far, include tenderness at the injection site, feeling cold or experiencing what we call chills, mild fever relieved by ordinary paracetamol or acetaminophen, feeling tired, unusually tired, body aches, and probably mild headache. So these are the most common post-vaccine symptoms highlighted to date by our people. Now, in the first allotment of vaccines that we received over 20,000 doses, and we would have covered approximately 10,408 persons so far from the first allotment of vaccines that we would have received. And so this is an achievement because we covered this amount of persons well ahead of the cut date of April the 16th. And so this is a big achievement for us here. Now, we would have received the second allotment of vaccines last week, Wednesday, April the 7th. More specifically, we received 21,600 doses last Wednesday. And so, ladies and gentlemen, we have already started administering these doses in St. Kitts and in Nevis. And so, if you are ready to accept this vaccine, all you have to do is to show up at any of the 17 health centers within the Federation. In St. Kitts, the vaccine is being offered in the afternoon hours between 1 to 4:30 p.m. In Nevis, I gather that you can access the vaccine during the morning hours. So if you are ready, there is universal eligibility, so that means we are no longer following the priority groups. Once you are ready, once you're over 18, you want the vaccine, you just have to show up at any health center and you can access the vaccine. Access to the COVID-19 vaccine is crucial to curbing the spread of this pandemic. Our aim in the Federation is to reach the herd immunity threshold by summer of this year. So what is this herd immunity threshold? The scientists tell us that the herd immunity threshold for COVID-19 is approximately or anywhere between 70 to 90%. So the specific cut point is still being determined, but we are given a range of 70 to 90%. And so given our age structure, based on our last census for the Federation, we are aiming at attaining population herd immunity threshold of 70% by summer of this year. And this is important because if we are successful in vaccinating 70% of our population, which indeed is our adult population, those who would be vaccinated would provide indirect protection to the vulnerable amongst us. And these vulnerable include our children who are under 18 and our elderly, our frail old who have multiple medical conditions and who are unable to take this vaccine. And so, ladies and gentlemen, I implore you to get the facts, empower yourself with the facts about the COVID-19 vaccine and the pandemic on a whole, and choose the vaccination. It's our best shot at protecting ourselves. Now, many are asking the question, how so? All right, so if you choose the vaccine and you've received the 2 doses, 2 weeks after you would have received the second dose, you're deemed fully vaccinated. Now, that provides you protection against the SARS-CoV-2 virus. It provides you protection against picking up the virus because you would have an 83% reduce risk of picking up the virus. If perchance you do, it reduces your risk of becoming ill. It reduces your risk of becoming very ill or severely ill. It reduces your risk of going to be being hospitalized, going on the ventilator, and dying. So it protects you. It protects your family. Because if you are vaccinated and your household, meaning all the members of your family or your household, are protected, it means if the virus is circulating in your community, your family, your household will be protected. Now, if you were to say aim, and if you were to advocate for the community members to be vaccinated, it means if we have an outbreak of SARS-CoV-2, you will be protecting your community. So those communities who have come out and have come on board and accepted the vaccine, if we were to have a community outbreak, those communities will be spared. So you won't have many persons falling ill, you won't have many deaths. And by extension, if you accept the vaccine, you'll be protecting the Federation on a whole. We cannot forget the essential public health measures in terms of, these are the prevention and control measures for SARS-CoV-2. So yes, we still have to wear the face mask because our children are not being vaccinated. So some persons are asking, if I go and take the vaccine, why do I still have to wear the face mask? Because guess what? Everybody, the vaccine cannot be given to everybody. We still have those who are vulnerable amongst us, our children and our frail elderly. And so that's the reason why we must still continue wearing the face mask, maintaining hand hygiene, maintaining the safe distance away from others. These measures automatically and generally prevents the spread of SARS-CoV-2 or any infectious disease for that matter. Thank you.
Thank you very much, Dr. Laws, our Chief Medical Officer. I now invite the Chair of the National COVID-19 Task Force and the National Disaster Coordinator at the National Emergency Management Agency, NEMA, Mr. Abdias Samuel, to give us his report.
Thank you, Mr. Williams, and a pleasant good afternoon to all who are here joining us via all means. Today I want to focus my presentation on our present national response to the eruption of La Soufrière volcano in St. Vincent and the Grenadines. The government of St. Kitts and Nevis would have, through a statement by the Honorable Prime Minister, would have advised the general public of the two-phase approach to the national response in assistance to the people and government of St. Vincent and the Grenadines. In phase one, we looked at a financial assistance in the sum of EC $1 million, and two, we looked at immediately releasing to SEDEMA US $20,000 towards the Special Emergency Assistance Fund so that they can support logistical operations on the ground. In addition to that, and in phase one, we also looked at providing providing human resource through our defense force and police force in support of the regional security system by having having officers support give technical support and conduct peacekeeping efforts in St. Vincent and the Grenadines. My understanding is that our forces are on standby and there's a possibility that a deployment can come as soon as Friday of this week. We also, in phase 1, committed ourselves to helping with a relief supplies drive to that of a needs list provided by the government of St. Vincent and the Grenadines. And the list was as follows: drinking water, a respirator face mask with filters, non-perishable dry food items, bleach, disinfectant, liquid soap, and personal hygiene kits. I am pleased to inform the general public that a 40-foot container and a 20-foot container with these items were shipped yesterday to St. Vincent and the Grenadines, and my information is that St. Vincent and the Grenadines would have received these today, Wednesday. So thank you to Tropical Shipping for their support in this regard. Phase 2 of our national response to the impact of La Soufrière eruption would be the acceptance of displaced persons in the amount not exceeding 300 persons. And this includes families of 2s and 3s. And to manage this operation, the Federal Cabinet has approved the establishment of a St. Kitts and Nevis Displaced Persons Planning Committee. And this committee will guide the criteria of screening, applying the COVID-19 protocols, providing welfare and basic needs to ensure safety and security of these persons, and including our residents alike. The committee of displaced persons will come from will come from these agencies and ministries. Ministry of Social Services, who will be the lead, and this will be led by the permanent secretary of this ministry. Ministry of National Security, and that means, when we say national security, we mean the Secretariat. Immigration Department, the Royal St. Christopher and Nevis Police Force, NEMA, Ministry of Finance, Ministry of Foreign Affairs, Ministry of Education, Ministry of Health, Mental Health and Psychosocial Committee, Labor Department, Chamber of Industry and Commerce, Christian Council, Evangelical Association, St. Kitts and Nevis Red Cross Society, Nevis Disaster Management Department, and a representative for Customs and Excise Department. So each ministry and department and institution will provide one representative to make up this committee. This committee will guide the process, again, for the screening tool that will be applied in St. Vincent and the Grenadines in collaboration with NEMO in St. Vincent, and then it will guide the process of arrival into St. Kitts and Nevis and what happens then, thereafter. The food drive, again, I want to thank every contributor. We would have had 264 contributors, and we would have amounted goods to the sum of 150,000 EC dollars. And again, we really want to thank everyone from our corporate partners to the ordinary citizens who contributed in this regard. I am encouraging persons to make monetary contributions. You can do so by going to the Treasury and giving your donation, along with having the option to deposit at the St. Kitts Nevis Anguilla National Bank to the account number 101-269-63 in the name of the Accountant General. Please, let's continue to show solidarity with the people and government of St. Vincent and the Grenadines. We will continue with this time a national food drive. Again, we will continue with a national food drive, that's NEMA, and we have a 40-foot container here at the NEMA compound that we need to stock so that we can ship out next week, Tuesday, again, to St. Vincent and the Grenadines. I am again appealing to the general public, the business community, NGOs, churches, and everyone to bring your non-perishable items, dry food goods, and donate them for our suffering friends in St. Vincent and the Grenadines. The cutoff time for this national food drive will be Monday the 19th by 12 noon. I'm asking everyone to support this very important venture. Now, some question some questions have been coming to us regarding our volcanoes and volcanoes throughout the Caribbean region. And in consultation with the UV Seismic Research Center in St. Augustine, Trinidad, they have indicated that the eruption in St. Vincent will not be linked to any other volcano. What do I mean by that? Because this volcano has erupted, it doesn't mean it's going to have a chain effect, as the volcanoes are not linked. So it says basically in the communique, volcanoes in the Caribbean are not connected. Volcanoes and individual islands are formed by the same process, subduction at the plate boundary, but they do not share the same magma chamber, nor are they a long connecting magma conduit. A volcanic eruption on one island, therefore, cannot trigger an eruption on another island. In St. Kitts and Nevis, we have our volcano at Mount Layamigo, which is approximately 3,792 feet, and Nevis Peak, which is 3,232 feet. We continue to monitor these volcanoes with our seismic monitoring systems that are in place, and they are also monitored at the UV Seismic Research Center in Trinidad. And the question again, what will St. Kitts do? We have a mass evacuation plan that is in draft form, and that will be applied in the event that we are faced with this threat. And we also have a volcano hazard map that indicates the various impact zones using a color coding system. And this will basically give us the idea how do we prioritize evacuation if St. Kitts has to become under any threat. I want to advise the general public that we are a short way from the start of the hurricane season. And to date, the Colorado State University has given the first hurricane forecast. Now, this is how it goes. They give the first forecast, and then they continue to monitor, and this forecast can change. It can increase or decrease. At present, they have indicated that we have a above normal season for the 2021 Atlantic hurricane season. There are 17 named storms, 8 hurricane, 4 major hurricane, meaning category 3 or higher. Now, this complexes everything for us in the Caribbean region. So we have been focusing on reopening the borders. We have been focusing on getting you inoculated. Now, we have to also focus on the hurricane seasons on top of the inoculation. So if we really want to move quickly, then let's move quickly to inoculate, vaccinate. Let's prepare for the hurricane season, because this poses another challenge for us. Last year, the capacity of the shelters had to be reduced significantly. There's a system that we use called the buddy system, and that is what we first encourage if we become under the threat of any major hurricanes, meaning that be your brother's keeper. So a neighbor is encouraged to accept a neighbor into his house. I am saying to you, I don't know if your neighbor would want to accept you if you are not providing some level of safety to them. Also, I want to advise the general public on something that is being asked as well. The air quality. The Antigua Met Office would have provided us with an air quality forecast, and they have advised that the air quality due to the Sahara dust has fallen to moderate level due to the Sahara dust, and also the potential of particles, ash particles, reaching the northeast region. Every year we are challenged with the Sahara dust that comes off the west coast of Africa, travels the Atlantic, and enters into the Caribbean islands. And this is compiled with the potential of light particles of ash, depending on the air currents and the higher levels of the atmosphere, bringing it up to the northeast regions in the Caribbean, the two of them mixing and creating an uncomfortable environment for persons who may suffer from respiratory illnesses. So I'm advising the general public to exercise caution. Please wear your mask where necessary to protect yourselves. I too want to join with Dr. Wilkinson in expressing my condolences to the fallen nurse Josephine Adsel, and I appeal to the general public for us to show a level of sensitivity to the passing of this nurse who would have served our country well. She would have left her country to come here and serve, and I think she deserves that dignity. So to the family, friends of Nurse Josephine Adsel, who I met at JNF while seeking assistance there, and she was and she was very nice in delivering her services. So again, I appeal to the general public for us to show some compassion to her family during this difficult moment for them. Thank you.
Thank you very much, Mr. Samuel. That brings us to our question and answer segment. And the majority of my questions today are from Vaughan Radio in Nevis. And the first question, the Prime Minister recently confirmed that the Federation will be accepting a number of Vincentians or people from St. Vincent and the Grenadines. When can we expect to see these arrivals in St. Kitts and Nevis? That's the first question. Mr. Samuel.
Thank you, Mr. Williams. There is no specific date. This will be a well-coordinated activity when the NEMO would advise CDMO, who would then advise the country. Also, we will have the Ministry of Foreign Affairs in St. Vincent, who will be a part of this collaborative effort, and they will notify St. Kitts and Nevis when they will have potential candidates who will meet our criteria for being accepted into St. Kitts and Nevis under this particular designation. So at the present moment, we cannot say when this is going to happen. It's going to be dependent on the request from the affected state to the countries who are providing this option.
Mr. Samuel, don't go too far. I think this question is yours as well. Are there any local hotels, apart from the COVID-19 approved list of hotels, that have expressed willingness to receive the Vincentians?
There are two options that we have considered in terms of acceptance of displaced persons from St. Vincent. One is our citizens and residents, our hospitable citizens and residents, who may want to accept them into their home as a form of sponsorship, or families or St. Vincentians, who are living in St. Kitts and Nevis, and they want to have their family return from the impact zone or the affected areas. And the next option is what you just mentioned, Mr. Williams. I want to thank the Marriott Hotel, who has come forward and has stated that they have 30 rooms they will make available to support this activity. Also, the Koi Resort has indicated they will make 70 rooms available, and also Sugar Bay Club has also come on board and informed of approximately 30 rooms they will have available. And Nevis, my understanding from our colleagues at Nevis is that Mount Nevis is being considered, and they have indicated that they may have 30 rooms on Mount Nevis Hotel to provide these services for the potentially acceptance of displaced St. Vincentians and the Grenadines. St. Vincentians, right?
This question is for Superintendent Henry. A few months ago, it was said that the COVID-19 task force had condemned large gatherings. Why were there, and that's the reason why there were no sports meet in the Federation. Can you please explain to the public why other events that are attracting large groups of spectators as was recently seen over the Easter weekend, why weren't these events stopped, as they were not in accordance to the current rules and regulations?
Just one correction, we did not condemn large events. In fact, the COVID-19 regulations categorize events into 3 categories: small, medium, and large. Large events are events with participants from 101 to 150 persons. So events can be permitted with 150 persons. Over the weekend, over the Easter weekend, those events that were approved for 150 persons, and they had in excess of that 150 persons, those events were required to stop their operations. And as I mentioned last week, in one case, one organizer was arrested and is currently before the court awaiting his trial for his violation of those particular protocols. So events are permitted. The maximum number for outdoor events are 150, and persons who violate that number, the compliance team are very vigilant and always make their checks and ensure that these events are kept within the numbers approved.
Thank you, Superintendent. This next question from Vaughn also is for one of the medical doctors in the room, Dr. Wilkinson or Dr. Laws. If an individual has just gotten over a bad flu, is it recommended or is it wise for them to take the vaccine right away?
Very good question. So once you would have gotten over the flu, it means that your symptoms would have subsided. So you're no longer coughing, sneezing, you're not experiencing any fever. So yes, once you would have gotten over the flu, you can proceed and take the vaccine.
And the next question as well goes to one of the medical professionals. From Von Radio again. Considering that we were told that, they say a bottle of vaccine, but I think they mean a vial. A vial of vaccine contains 10 doses, and once it is opened, it must be used in a specified time, roughly about 24 hours, if I'm correct. And there is currently a low turnout of people wanting to be vaccinated. How many, if any, doses have had to be discarded and thus wasted so far?
Okay, thank you for the question. I want to say, though, that to date, we have vaccinated 11,152 persons in the Federation of St. Kitts and Nevis, which represents 33.8% of the target population. And this is significant per capita compared to many countries around the globe. And so it is false to say that we are not vaccinating at a good rate. On average, now we vaccinate between 190 to 200 and something plus persons per day. And at this rate, we hope to reach herd immunity by the end of September. Yes, we would like to see an increase in the numbers because of the short shelf life of the vaccines, but I believe that we are doing a good job, and I want to congratulate the 11,000 plus persons who have stepped forward so far to do the right thing and taken the vaccine to protect not just themselves, but the persons around them and the vulnerable. And so I want to encourage others to follow in their footsteps. To date, we have wasted no vaccines because we always make sure that we vaccinate persons in groups of 10. And so sometimes even if we go to a community center and there are 5 or 6 persons who step forward and said that they wanted to be vaccinated, unless we get 10 or 12, we would give them an appointment to come the following day. to the clinic to be vaccinated. So no doses have been wasted thus far. Thank you.
Just to our questions and answers, we thank Von Radio, who submitted all of the questions today. Thank you for your questions, and I hope that you are satisfied with your responses. Now, this morning I was reading in Al Jazeera, the news, that there's something now you call vaccine tourism, where people are leaving their borders and going to other countries in order to take the vaccine. So, I am thinking, you don't want to take the vaccine, then you have other people who will come here as tourists to take it, because in some places, really, they're on a very long list to get the vaccine. Some people, I mean, in some countries, it's going by age group. And from what I understand, for example, in England right now, I was listening to the BBC, they have just reached the 40-somethings. They have just reached the 40-somethings with the vaccine. So what we're basically playing around with here, people are longing, wanting the vaccine. I know that, you know, we need information and so on and so on. People are saying, oh, nobody's really going to tell me what to put in my body. But at the very same, the vaccine is something good because it is supposed to protect us. However, we're putting all kinds of things in our bodies. Putting the alcohol, we are putting the drugs, we are putting the fats, we are putting the sugars, we are putting all kinds of things that are basically detrimental to our health. While the vaccine is something that is really supposed to help and to make us immune towards a disease. And the benefits of the vaccine far outweigh the risk. As I was listening to the news, I also heard that they've put a hold on the Johnson vaccine because of 6 persons with rare blood clots. And yet over 7 million people have been vaccinated with the Johnson & Johnson vaccine. 6 out of 7 million is really negligible when you have to think of it. So the benefits far outweigh the risk. I want to thank all of our presenters today. Dr. Wilkinson, of course, you know, for your touching tribute of the late nurse Josephine Arceo. Of course, you would have worked with her, and you know, it is sad that she passed away, but nonetheless, you know, the tribute that you gave in showing her dedication and her service to the medical fraternity is absolutely remarkable. It was important. Dr. Laws, for your presentation on the situation report. You know, it's amazing because I have to mention this, Dr. Laws, that so many scientists in the region at the very highest levels, at university levels, the University of the West Indies, you hear them and they're pleading to the people to take the vaccine. The top doctors in the region, those who are teaching at universities, professors and so on, they are speaking about the benefits of the vaccine. I don't know. What else do we really need? Thank you, Superintendent Henry, who continue to, you know, update us in terms of the COVID-19 Act and what we're supposed to do and keeping us in line, because that is important. We thank the Honorable Wendy Phipps. How can we miss her? She is here as usual and continues to support us here at these briefings and on the National COVID-19 Task Force. We thank Mrs. Christmas Jacobs for her service of sign language, which is so important. Internationally, that is what we see now. And St. Kitts, of course, has come of age in that we can provide sign language. We thank ZIZ, and we thank all the media who continue to to provide us with information, accurate information, timely information, relevant and pertinent information, because the media plays a crucial role in the management of any crisis. Communication is extremely important. We thank Mr. Abdia Samuel, who of course is wearing two hats. He is the National Disaster Coordinator, and he's also the chair of the National COVID-19 Task Force. Thank you very much, sir, and I hope I am not missing anybody. I thank all of you for tuning in today for the COVID-19 briefing. Next week we will be back. Until then, take good care. I am Les Roy Williams.
Is on.